And ladies and gentlemen, we go now live to a press conference held by Minister of Health, Dr. Hela Zayed.
وأول صديقة اللقاح يجوا دلوقتي عبد المنعم. برحب بيكم جميعا واحنا في
and we are in one of the health ministry hospitals that was on the front line. At the beginning, the Abu Khalifa hospital. The Abu Khalifa hospital was the second hospital to receive coronavirus patients. After the Nagila hospital, I hope we could all be in Nagila hospital, but because it's far away, for the journalists and the media, we decided to gather in this hospital. And I was honored to be one of the people who tried this vaccine that we take today and I was one of the people who tried this vaccine, and we registered this vaccine in the Egyptian Medicine Agency. The efforts of the country to protect the medical staff is one of the priorities of the Egyptian state, and yesterday the President announced the beginning of the inoculation of medical staff. I would like to say in this regard that there are priorities for the entire world, and we are following the steps of the entire world. The first thing is the medical staff at the front line, because the medical staff meets patients of the coronavirus. That's why they have the priority. And any workers in the health ministry or public hospitals or the armed military hospitals, they all have the right to get the vaccination at the same time and this is what we have done, and God willing, starting from Saturday, all the hospitals in Egypt, public hospitals and hospitals pertaining to the military will receive the vaccine. The second priority is the medical staff who are facing regular patients, not COVID-19 patients, then followed by the elderly and people with chronic diseases and immunity diseases. The fourth tier is people who are over 75 years of age, and then the rest of the population. But people also, pregnant women and are also also prioritized. The vaccine is the clinical experiments have proved that the vaccine provides 99% of protection and 100% protection of COVID-19 with severe symptoms or acute symptoms. Even if you got symptoms of COVID-19, the symptoms will not be as severe. Today I come to announce the launching of the national campaign for COVID-19 from the Abu Khalifa hospital, and the beginning of the national campaign. First, the medical staff at the front line will receive the vaccine, and I'm honored to be with my colleagues Dr. Abdul Menam and Dr. Ahmed, the nurse, the first doctor and the first nurse to receive the vaccine. This is, God willing, this is a good start, and I would like to tell the Egyptian population that we know from all over the world that there is an international demand for the vaccine, and that the production will not be enough for all the demands, but by the arrival of the shipments to Egypt, we will start inoculating more people of the population, and in a few days we will receive shipments from other companies as well, from Sinopharm as well, and so there will be an expansion as the shipments enters. It becomes analyzed in the drug agency laboratories. So I reassure the Egyptian people, and I confirm and assert the fact that the vaccines will not does not mean that we should not take precautionary measures. So I remind you that we have to take the precautionary measures. We don't know the coming period, what will happen in the coming period. That's why let's continue taking the precautionary measures, because even people who take the vaccine will take time until they develop the antibodies. So we should all abide by wearing the face masks and taking the precautionary measures and preventative measures. I remember at this time all the heroes that we have lost, and because of them, after God's providence, the Egyptian nation could surpass this crisis. I will never forget their souls and their giving and benevolence and all the memories. With all respect to their memories, I say that they were a very important reason that Egypt surpasses this moment. I trust the medical staff greatly, massively, and they have written a new history for medicine in Egypt with words of light, with all chivalry and nobleness. I remember all people we have lost with all the mercy and all the gratitude. We will never forget them, and their memory resides in our hearts. God protect all the medical staff in Egypt, and God willing, during the coming period we'll witness more protection for the entire world, and the entire world will surpass the crisis peacefully. Thank you very much. Thank you, Health Minister Hala Zayed. Now with the question of the journalist Muhammad Hilmi from the Egyptian television. Your Excellency, we congratulate you. Today you announced the new vaccines. Dr. Abdurrahman and Mr. Ahmed were courageous enough to face the safety of the vaccine. Your Excellency, during your third visit to the isolation hospitals, you said that we can start with the world with the strategic amount for giving the vaccines for people with chronic diseases. Do we have the strategic quantity of the vaccine to inoculate medical staff, and when do we start inoculating the elderly? When will people with chronic illness and the elderly be able to register for receiving the inoculation? When will the Sinopharm vaccine arrive in Egypt? Did we register with other companies like Pfizer and other companies? We have so many questions, but let me start with the fact that Egypt was the first country in Africa to receive the vaccines. It's also the first country in Africa to start the vaccination campaign. We have the vaccine for a very long time, but we decided to start the campaign after guaranteeing the continuous of the shipments. Now we have the supplies, and in the coming days we will receive more shipments, so there will be an expansion according to the needs that we see and the demand, and according to the priorities. Citizens above 75 years of age will go to one of the health ministry hospitals and registers, and after we open the door for receiving the shipments. We will announce in a few coming weeks the start of the vaccination for the elderly. He will have two choices. He will either enter the system that will be announced in the news bar of all the channels, and so he could register, any citizen could register, or he will go to the hospital in his area and they will register him. The most important thing is not having crowds, because people who are about 75 years of age, who will register according to the diseases that they have, and the system allows for us to put in it 3 medical reports in the system. The system is safe and is tied to Takaful and Karama, so we would know the social situation conditions for all the citizens. The third question that you have said, the other companies, we are registering now for 3 more companies, a Chinese company and an English company and a Russian company. Any vaccine enters Egypt is a vaccine that we have to make sure it's effective through the drug agency or the health ministry and the scientific committee in the health ministry. So once it is approved, it's safe, and it's like any, and the same will happen to the Chinese or the American vaccine. If it got approved, the approval or the registration in the health ministry will prove that it is safe according to the tests that it will undergo after it arrives. So after the vaccines are approved and registered, we will receive more of these vaccines, more shipments of these vaccines. Samir Omar from Sky News. Your Excellency, relating to the deciding a preliminary date where the regular citizens can receive that vaccine, we would like to know when any citizen can receive that vaccine, and we all would like to listen to the voice of people who have taken that vaccine. So it will be an invitation to everybody who fears taking the vaccine. Because this will have a positive impact on people receiving the vaccine. Relating to deciding a specific dates, most advanced countries gave definite dates to the citizens, and people in advanced countries, either in Europe or countries in the area, as announced officially that they cannot fulfill the dates that they have given, because the companies that manufacture these vaccines are limited, and their manufacturing capacity was not enough to live up to the expectations of these countries. But let me tell you that we are registered in the International Association for Vaccinations in relation to the COVID vaccine availability, and we received official promises and official plans from Dr. Sistertli that, God willing, more medical staff will receive inoculation during the first quarter of this year. And the Gavi has announced 2 days ago that one of the international companies that develop the vaccines will provide Gavi with 40 million doses, according and he called the community that this is unjust. Ahmed and Dr. Abdel Men'em, after I finish, can talk freely, because I intended to bring Dr. Ahmed and Dr. Abdel Menaim to give an assuring message, but I hence say that two things, that when the clinical experiments were started, I was one of the people who participated in these experiments on this vaccine. And the Egyptian Drug Agency will not take the approval of the emergency unless we are sure of its effectiveness. Mr. Abdessalam, good afternoon, Your Excellency. I would like to thank the President for his great efforts, who did not spare any efforts in providing the coronavirus vaccine to the Egyptian people, and to provide, like other countries, the vaccine to the Egyptian people. I also thank you for your great effort in facilitating the procedures for the providence of the vaccine. My question for you is, I would like to know the plan of the distribution of the vaccine in the coming, and 40 million and another 40 million in Gavi, and so we're storing more than 40. We booked for more than 40 millions of doses, and according to the directions of the President, there is no financial challenge in getting the vaccines, and the Tahya Masr fund will support the social justice in receiving the vaccines and the financial dealings. This will be an expertise also for the Egyptian society that will be taught at schools, and also the administration of the vaccines, we hope, will be as simple and will fulfill the social justice. Good evening, Your Excellency. I have a question. Do we have an estimation of the number of the medical staff who will receive the vaccine in the coming days, and also the tiers who are prioritized to receive the vaccine? The second thing is, you have received the vaccine previously. How do you reassure the medical staff who are afraid to receive the vaccine? I would like to know your message. Thank you, Ahmed. The first thing is, I would like to start from the end, from your last question, about the safety of the vaccines. This is an emergency approval that we have to take after undergoing 3 clinical stages. Then the vaccine is approved in the drug authority, and then the emergency approval is announced. So we are working in alignment with the world concerning this, and I reassure my colleagues that until now there is a safety and effectiveness according to scientific experiments and researchers. The second question was about... Yes, we have an estimation of the number of the medical staff and people who are mostly in need. I won't say the number, but we have an estimation, whether in the health ministry, and we have contacted all governmental parties, whether in public hospitals or in other hospitals, but we have an estimation, but we need a verification with the national identification number. So we have an estimation, and regarding citizens who have a medical insurance, a public medical insurance, we have an estimation of their number, and also people who are receiving chronic illness medications according to the state expenditure system, also through the state expenditure system in the health ministry. ministry. After the citizens, once the citizen is registered, he will take his turn. And as I told your colleague from Sky News, that we cannot specify a date now because the countries who gave a specific date did not fulfill that specified date, because of the international problem in the manufacturing lines of some companies. I thank you, Your Excellency, for the great effort that you are exerting in a crisis that Egypt have not passed through before. I would like to ask you, when will be able to manufacture the coronavirus vaccine? Is there a plan that the government, that the administration have to, for the governments that will receive the vaccine first of regular citizens? I thank you for your first question. We have a plan, and in September, we invited the World Health Organization, who sent experts from France and other countries to assess the manufacturing line in Vaxera, and they have a very positive report. We sat with international companies who manufacture these vaccines to start the manufacturing realm, and in a few weeks there will be a joint manufacture contract that will be signed, and they see that Egypt is able to manufacture the vaccine for its own needs and for other African countries, and we will welcome you all in the signing ceremony. Egypt, in the 27 governments, Egyptian governments, there are centers that are established for citizens, but the medical staff will receive the vaccine in its hospitals where they work. So people in the Abu Khalifa hospital will receive it here, and the people in Homiat and Beba will receive it there. But the citizen will, but regarding the citizen, the president directed to raise the qualifications of the vaccination centers, and we work with the agency to raise the effectiveness of these centers. And so after the more shipments arrived, we will start the vaccination campaign for the regular citizens to end this pandemic. I would like you to hear Mr. Abdulmenam and Mr. Ahmed, our colleagues who were the first to receive this vaccination in Egypt. Thank you, Your Excellency. Thank you, dear guests and journalists and media people. Doctors, our colleagues, if you would like to talk to